To begin, I would like to talk a little bit about diversity and where it appears to begin. We learn from a young age that people look different, talk different, practice different religions, and we've learned over time to judge them. Now, depending on how you perceived those differences that you noticed amongst the different people, that leads to whether or not you're negatively judging them or simply just noticing that there is a difference between you and another person. This will be crucial for medical professionals throughout their entire career. Science has taught us that there are many differences between each person that we treat, and that all people don't respond the same way, react the same way, or even feel pain in the same way. But what we don't learn is how similar all of those differences truly are. Later, we will explore how biological diversity plays a role in just what the differences are and what their similarities are. And with that, we'll look a little bit into history and how we've unfortunately let the appearances and statuses of other people determine their successes in life without truly having an acceptable reason to do that. And that is the one thing that we cannot let affect medical care. When we allow appearances, social status, culture, or race affect a patient's quality of their medical care, we have failed. We fail as healthcare employees. We fail the entire healthcare system, and most importantly, we fail the patients. They suffer and they feel abandoned by those who are there to help them. In recent years, research has shown that this is becoming a growing issue. More and more patients are having poor and improper care solely based upon their personal diversity. And that is something that we need to recognize and we need to change. To make that change, we need to overcome our biggest problem, which is fear. Too often than not, we fear people that are different from ourselves. And as healthcare employees, we need to be open about those differences and grow from them. Once we can accept that, we will learn from it and eventually provide proper quality healthcare to all patients who walk through our doors. Now let's talk a little bit more about this presentation specifically. Today, hospitals are discharging patients so much earlier than they were before. They're having a surgery and being discharged 2 days, 3 days later. This means that patients have a minimal amount of time where they need to receive standardized, unbiased, and quality care. Now, those who have different appearances or cultures or socioeconomic statuses may be at risk to receive less than par care. And that's something that we need to prevent. As nurses, doctors, and healthcare providers, we must base their care solely on the patient's needs and place all judgments aside. A large barrier that healthcare workers need to overcome is the innate response of judgment. Each patient deserves equal respect and care regardless of their monetary situation, appearance, or even medical insurance. And unfortunately, that's not how all medical professionals operate. And that's because they're human. And some people may not notice that this is occurring. But unfortunately, these responses from healthcare employees create responses that are so negative for the patients and unbeneficial. So it is something that we need to pay attention to and we need to change.